Hi, I'm Katie Sokolovsky from Universal Primary Care here in Olean. I'm collaborating today with Southern Tier Healthcare Systems to talk about birth control. There is always a hot topic related to contraception, and I'd like to give you some basics of what's involved with birth control, as well as maybe bust a few myths related to um, how they're used, how effective they are, and under what conditions people can use them safely. Primarily, they fall into two categories. Barrier methods are in the non-hormonal category, as well as one specific IUD. So if you're avoiding hormones, your options are condoms, diaphragm, and the Paragard IUD, which is made out of copper. So they all have their pros and cons as well. Condoms, of course, are the only method of birth control that also provide protection against sexually transmitted infections. Hormonal categories are a wide gamut of options that are available to women who need adequate contraception. Most people immediately start to think of birth control pills as a way of preventing pregnancy, but there are various other options that are actually even more effective than those. Pills are great, they work, they're cheap, they're easy to use, they're easily tolerated. However, you have to take something every single day in order for it to work effectively. So most of the time, especially if somebody's not planning on a baby for quite a while, we talk about other options. There's the birth control ring, there's a birth control patch. Those also have hormones in them. And then there's intrauterine devices, which are called IUDs. And then there's an implant in the arm called Nexplanon. So those options offer a little bit longer term hormonal effect and are more user-friendly because, frankly, you can't mess it up. So once the IUD is in the uterus or the implant is in the arm, you could have protection against pregnancy from anywhere from 3 years to 5 years. However, if situations change and you're ready for a baby, they can be removed, fertility returns immediately, and you can start or add to your family when it's on your terms. Most birth control works by suppressing ovulation. So what that means is the medicine in there causes your body not to release an egg. And so if you don't release an egg, you can't make a baby. And so that's the primary method. However, some of the other hormones offer the benefits of less bleeding during periods, less cramping, shorter periods, something a little bit more predictable about your menstrual cycle. In regards to some myths, a lot of urban legend apparently says that you have to have a pap smear in order to get a birth control script from a doctor, and that's not the truth. Just make an appointment. We can talk about it. You probably can keep all of your clothes on for that appointment, okay? Especially teenagers. Here in the state of New York, gynecological care is accessible to teenagers without their parents' permission. And it's a private relationship that unless I have permission to speak with the parents of the child, I do not have to. I'm not legally obligated to. Other barriers to birth control can include the cost of them. So under the Affordable Care Act, instituted a few years ago, contraception was required to be covered in full. And so if you have any source of health insurance, you almost always have access to free birth control. Some women do not think they can use birth control while they're breastfeeding, and that actually is not true. You can use various different methods that will be safe while breastfeeding and still be able to space your children appropriately if you so wish to do so. There's also another option for people who are using condoms as their primary method. And for instance, the condom might break or it slips off or has a tear for various different reasons. And so there is the option of Plan B is the prescription for emergency contraception. However, over the last few years, that has become available over the counter without a prescription. So you don't even have to go to the doctor's office to get it. You just have to go to the pharmacy and ask for it. The pharmacist can give it to you without a prescription, but don't think it goes through your insurance, and so it might be a little bit more costly under those circumstances. Plan B is the most effective if you take it within the first 3 days after the unprotected intercourse. It may work up to 5 days after that event as well, and it will interrupt your normal menstrual cycle. And so if you have any questions, just reach out to your provider. So if you have any questions or would like to know more about birth control options, reach out to your primary care provider, your local midwife, or the county health department. The options are endless for contraception. You just have to use it.